So biological dentistry really focuses on the connection between the mouth and the rest of the body.
More than half of the population has periodontal disease.
The human body is smart. We know how to fix ourselves.
All right, welcome to Peak Mind. I'm your host, Michael Trainer, and today I have the honor and privilege of speaking with Dr. Mora. Dr. Mora, it's a pleasure to have you.
It's a pleasure to be here. Thank you for having me.
Well, thank you for having me. We're in your beautiful office, Tribe, in San Jose, Costa Rica. And I'll just share for the audience's benefit. I don't know if I told you this, but I actually had a ticket. So my dentist actually told me I had some serious oral issues. And we'll go into this more deeply, but because of my father had dementia and I started to realize the correlation between oral bacteria and the heart and the brain, somehow I wanted to take it more seriously. And I actually canceled my ticket. I was going to fly all the way to Thailand. I canceled my ticket to Thailand because when I actually looked on your guys, I was like, this is it. So I haven't told you that yet, but it was something intuitive. And I've been spending days researching this. So it's an honor to be here at Tribe. And the reason I came was because you guys are deeply experienced with biological dentistry. Now, for those listening, they may not know necessarily what biological dentistry is. So just can you give a basic overview of what this notion of biological dentistry is?
Absolutely. And again, it's a pleasure to be here. So thank you for having me and for choosing us before anything else that you have chosen before. It was a long flight to Thailand anyway. So.
Yeah, I saved myself some time.
But so basically, we created a traditional dental office about 20 years ago. Me and my partner who couldn't be here, Dr. Andres Fernandez. He's an oral maxillofacial surgeon and I'm a prosthodontist. So we've been dentists for about 20 years now, and we've been together in business for almost 20 years, almost that long. So we started traditional dentists, right? Because that's what you learn. That's what's available in the education world of dentistry, right? So we did a lot of titanium implants back in the day. We did a lot of metal restorations back in the day because that was mainstream. That's what you did. That's what was available commercially as well. And then about 10 years ago, we had the opportunity to go to Switzerland. We were invited by a distributor in the US that was selling this very nice white implants. And we said, yeah, let's go. Yeah, sounds great. And it's a free trip to Switzerland, right? So who's going to say no to that? And when we were there, it was completely enlightening and eye-opening, the things that they were doing over there, and the no metal thing, and the biological dentistry, and all these things that we're doing. And we said, well, what's that? I mean, we've never, especially in Costa Rica, we've never heard about anything even related to that. So we ended up going for 2 years, 3-4 times a year to Switzerland to get trained, and that was the beginning of an entire new career. It was like if we changed careers completely, right, and started from scratch. So to answer your question, biological dentistry, it's first things first, seeing the patient as a whole. Yep. We're not treating the mouth as a completely different realm, right? Of course, everything that you do in the mouth and a patient is going to be related to something. Biological dentistry really focuses on the connection between the mouth and the rest of the body, the mouth and the rest of the organs, the mouth and the brain, for example. The teeth are connected to the brain by a trigeminal nerve, okay? So everything that you do to a tooth, of course, is going to have an effect on the brain, right? Focuses on the materials that we use, materials that do no harm, right? So materials that are bioinert. Traditionally, dentistry still utilizes materials that are potentially harmful to the body, that are irritants, that can corrode, such as metallic implants, right? Materials that are alloys in a wet environment, they will corrode, right?
Mercury fillings, which I came down here to remove.
Wow, and this is why you were here. One of the most important things that you were here. So we do a treatment that's called SMART, which is safe mercury amalgam removal technique. So mercury is the most toxic material available. And somebody thought it was a good idea to put that inside a patient's mouth, right? So it's toxic while it's there, but it's even more toxic when you remove it in an unsafe way, right? Because you will release all these particles of mercury. Mercury will bind to your cells immediately. There's studies that show that it will bind into the base of your brain for 16 to 20 years. All the detoxification organs that we have in our body, the liver, the kidneys, all the mercury is going to be trapped in there for about 15 to 20 years. So again, somebody decided that this was safe to use in patients. and that is still safe to the day to be used in patients. This was banned in Germany a few years back, but it's still not banned in the United States. No. It's still not banned in Costa Rica. Traditional universities are still teaching this, right? So again, it was an eye-opener to understand that all these things that we were doing unwillingly, because we didn't know better, right? We could potentially be doing more harm than good to some of our patients, right? So that's what biological dentistry is, looking at the bigger picture, looking at how everything that we do in our mouth could be connected to our patients and how we can do better. And also the other part of it is how many of the modern disease are connected or have a gateway through the mouth, right?
Yeah.
You'll know all about gut health and the gut flora and all that. So the mouth is the first point of entry that goes directly into your gut, okay? So how can that not be related, right? Oral bacteria, cardiovascular doctors know this and have been knowing this for many, many years, how potentially harmful is the bacteria in your mouth to endocarditis, right? How before cardiovascular surgery, one of the first things that a cardiovascular surgeon will tell the patient is to go to the dentist and get their teeth cleaned, because potentially that connection can be deadly, right? So that's just the tip of the iceberg. But yeah, we'll talk about more. I know.
Well, just what occurs to me as you shared that, that was the wake up call for me. That's actually why I'm here today, because I have very good dentists, actually. And I would say even dentists that were biologically oriented. They weren't biological dentists, but I went to my dentist and he was the one who actually woke me up, because he was like, man, you've got periodontal, you've got gum disease. And I can't speak globally, but in the US, I saw over 50%, more than half of the population has periodontal disease. And gum disease, basically, then I realized that the gum, like you just said, the mouth is the gateway to your entire system. And I just did, I got the Oura ring, I just did the function health test, and it flagged my heart. And I was like, oh my God, the two are connected. Yeah. Like the bacteria, literally they're finding in your arteries, right? The bacteria from your mouth in your arteries, affecting your heart. And then Dr. Dale Bredesen, who is amazing, also functional medicine doctor, just published that beta amyloid plaques, they're doing research, it's not proven yet, but maybe related to dementia, and that could be an infection in your brain related to your oral bacteria. And so I was like, wow, that scared, honestly woke me up. It scared me enough to where I was like, one, deeply fascinated, but two, I was like, we need to sound the alarm. More people need to know about that.
Fascinated and also terrified.
Terrified.
At the same time, right?
Terrified.
Yeah.
But the good news is that I got real serious about oral. I mean, serious enough to where I just came down here for 2 weeks, and this is my core priority. I got to handle this, and I'm so grateful that I did. I came down, just for the benefit of those listening, the level of care, which I'd love for you to explain for those maybe listening that are considering this kind of treatment. You guys put in, basically, I don't know a better way to put it, but a balloon around my tooth. So that because I had all my mercury removed, so that none of the mercury, like you said, would escape to cause that 15-year sort of toxicity. But also I had glutathione drip and vitamin C in my veins. You were using ozone. Can you talk a little bit about some of the unique aspects of the practice that I was so blown away by, that maybe people who just go to a traditional dentist, they don't necessarily know what's involved.
Sure. Yeah, sure. So it's been 10 years in the making, right? And we're still learning as we go. There's so many things that continue to evolve, and a part of dentistry that we still love is high tech. Right? High tech technology, the way that it helps us, it's amazing. And all these things coming out with AI and dentistry, I can't wait for that to come along. But there's pillars in biological dentistry that we will use, right? So one of the pillars is the mercury removal in a safe way, as we call it before, the SMART, safe mercury amalgam removal technique. And that requires a series of steps that if you simply avoid any of the steps, there's a potential of contamination, right? And it's a contamination that is going to be very difficult to remove, as we said, how toxic this mercury is and how it binds to your liver, to your kidney, to your brain, to your heart. So we don't take it lightly, and we do as many steps and as many barriers as we can. Also, we as dentists, we're way more exposed than the patient, because we see this on a daily basis. Right. So imagine how many amalgam fillings we have removed in our lifetime, right? And it's been proven, there's studies that There's a lot of dentists suffering from early dementia, okay? And some of that is definitely correlated with mercury poisoning, okay? Wow. So part of what we do is that we do a dental dam, okay? Latex-free dental dam that's gonna cover your entire mouth, and it's gonna leave the entire field close to possibly anything that you could swallow or goes into your mucosa. But we'll also do activated charcoal so that all your mucosa is protected from that. We'll put a vitamin C drip, okay, with other vitamins, sometimes glutathione and B12. But the vitamin C, what it's gonna do is that it's gonna have your immune system boosted. It's gonna be awake. So if anything bypasses all these layers that we have, the immune system knows exactly, okay, so I need to excrete this. This is not good. I'm gonna encapsulate it. I'm gonna take it out. So the vitamin C is very important during all the processes that we do, during all the surgical procedures that we do as well. We always have a protocol of 3-day vitamin C infusions with glutathione. We also, sometimes we need to do antibiotics and there's no way around it, but we will also do them on the IV to protect the gut flora, right, and all that. Other pillar of biological dentistry is the root canals, the root canal removals, right? And this is something that, again, unwillingly, traditional dentistry has always done, and they're still doing to the day. So a root canal occurs when your tooth has died or is gonna die for any specific reason, right? A big cavity, or perhaps a traumatic event, an accident, you fell off your bike and you hit your front tooth or something like that. But dentistry, and this has been repeated many, many times, but dentistry is the only field in the medical world that will leave a dead organ inside your body. It's dead, right? Once you remove its heart, the living part of the tooth is basically a dead organ. So who thought this was a good idea, right? But we never questioned that, right? That's what you learned traditionally. So until we actually were educated and our eyes were open to this, then you start second guessing and you start saying, well, this makes total sense. Why would we do something like that? So removing the problem with dead teeth or dead organs in your body is that immediately they become gangrened, right? Like if you had a diabetic tooth or something like that. Or if you have appendicitis, right, and that's full of bacteria, you need to remove it, or else it's what's going to cause. Same thing happens to a tooth. It's full with bacteria. It's full with anaerobic bacteria, which is very harmful. So the immune system is always trying to keep this at bay so it doesn't go anywhere else. And then it leaves other areas of your body unprotected because all that it's trying to do is fighting against this dead tooth in the mouth. So we remove these dead teeth, we clean them properly, and we replace them by the next best thing, which will be a bioinert zirconia implant that has been proven that doesn't cause any battery effect because it's not made of metal, that it doesn't corrode, that it doesn't produce any irritation in the body or allergies or things like that. So I mean, these are things that, again, what we're trying to do is just better the quality of life, try to make things easier, try to make things cleaner, and just going back to basic. What's simpler, what's gonna produce the least footprint in the patient, and that's why all these biomaterials come into play. We have also fillings, the white fillings. They're materials that are made of BPA free, right? So it's just looking at doing your research and finding the things that are less toxic to the patient or minimally invasive to the patient, because at the end of the day, that's what we're trying to get, and this is what Thrive comes in a little bit, because dentistry, to us, it's been my career for 20 years, right? But after learning about all these things, then you say, okay, how can we help our patients even further? What can we make to do things even better for them? How can we optimize their health from a dental perspective, right? And that's when we started with this concept and this idea.
Tell us, because for folks listening, Costa Rica, to me, one of the things that I think is so, in many ways, you are innovators, in my view, because one of the most sustainable countries on the planet, no military. There's huge policies in regards to preservation of the environment. And at the same time, like a lot of countries, there are old school ways of thinking too, And so to me, this idea that you have with Tribe is super interesting because in a way, you're bringing this cutting edge orientation to a place that is in its own way cutting edge, but yet there's a huge need because, both I think in country from what I've seen, as well as globally, there's so many people that don't have access to these kinds of tools. So can you share a little bit more of what your vision is in terms of, obviously now you have this incredible biological dentistry, but for Tribe in general, what do you see coming?
So it's been, I think it's been my dream for 10 years, but I just realized it, right? Because there was always a missing link. I mean, we were doing so many amazing things to our patients, and we received patients with Lyme disease, we received patients with MS, we received patients with brain fog, with problems of sleeping, with all these debilitating autoimmune diseases that are coming into the game right now because of our habits, our lifestyle, what we are, just our overall environment, right? Mm-hmm. that we are embedded into. So biological dentistry, I think, is very powerful, right? But at the same time, now we're becoming exposed to all this health optimization techniques, biohacking techniques, functional medicine. One of our greatest referrals have always been the functional doctors, right? Mm-hmm. The functional doctor is probably the only, or one of the doctors that realize how potentially harmful is the silent infections in our mouth to our bodies, right?
Yeah.
So are the only ones, or the first ones, that are actually trying to make that link, make that stick. Biological dentistry, I believe, is less than 5% of the dentists around the world. Okay, so we're still pioneers basically in what we're doing. But how can we make that bigger and better and just become mainstream, right? And I think that the way that we do this is getting more involvement out of the patients and more involvement in what we do. So we're trying to create an environment where the patient can get their functional medicine right, can get their biological dentistry right, and can get their health optimization, everything all together, which is something that nobody else is really doing, right? You have these amazing places all through the world, your places that are amazing, and they have amazing research and a lot of technology and a lot of backing and all this, but none of them are integrating biological dentistry within part of their protocols, right? So that, I think, it's a missing link, because one of my mentors, Dr. Dominik Nischwitz from Germany, Dr. Dome, okay, which amazing. I know you know him, and he's a very good friend of ours. And he's all about education, and that's what we've been trying to do as well, just getting the word out, getting more people involved. And you have all these biohackers and health optimization summits and all these things, and we see all these patients that have they're sleeping well, they're doing their movement, they're doing their exercises, they're eating well, they're supplementing right, but there's always something missing. There's always that they doesn't allow them to become superhuman as they would like to be. And most of the times, we have been able to pinpoint that to a silent inflammation in the mouth, okay? So that's the missing link, and if we are able to just go ahead and merge all of these fields together, I think that it's only a win-win.
It's incredible. You said silent inflammation in the mouth. To me, I'm fascinated by this because I am a biohacker. I mean, for lack of a better term, I go to the summits. I've done all the things, and what I realized, and I think it's important, and I'd love for you to share a bit about like what people can do on their own with oral hygiene. Sure. But what I realized, and I think is not commonly talked about, I kind of had this idea, which I was like, oh, I'm doing good. I'm brushing my teeth. I'm flossing. I'm fine. Like I'm a good boy. I'm good. And then what I realized was like, there's a certain level at which, for example, when I got diagnosed with periodontal disease, it finally dawned on me. It's like, okay, no matter what I do, there's now a level at which I need to SEAL Team 6 of medical practitioners to come in, because no flossing, like the bacteria, the inflammation is now deep enough to where I can't fix it, even if I'm doing the best biohacking personally that I can do. And when I flew in, I'm just a little maybe TMI, but part of the reason I did it was I needed you guys, for me, were the SEAL Team 6. I had, I had mercury all through my mouth. I had wisdom teeth that were infected. And, I had a few other things going on. So I've been very grateful to spend, a week plus here. And I've seen you probably 4 or 5 times, and it's been amazing. But what that's come from is there's certain things like, Dr. Fernandez pulled out like a pocket. I mean, this is kind of gross, but a pocket, when he extracted my wisdom tooth, he showed me like a pocket of bacteria that nothing I could have done on my own to attend to that. And so I think there's also this education that comes that I think a lot of people, even who are biohackers, who are pretty far along, you gotta find your tribe. You gotta find your place where it's like where you have people you trust. Because also, like, to be totally honest, I had flown to Thailand and like maybe they're totally competent dentists. I'm sure I could have gotten my wisdom teeth pulled or whatever, but I'm not sure I would have had the same orientation where I've got literally glutathione, vitamin C, I've got PRP, I've got ozone being, so I avoid cavitation.
Yeah.
That's a level of wizardry that I think most people aren't familiar with. So can you talk a little bit about and we talked a bit about some of these practices, but like ozone, for example, and PRP and how, and cavitations, and like, what are these aspects of our mouth and people coming to know their mouths and ways in which we can attend to the disease that is so common, unfortunately, in a way that, like you said, supports our whole body system, which is I think what those who are listening care about.
Sure. From how to get started, right? But first things first is the diagnostic. How important it is to get the root cause before you actually start, right? And we have an amazing technology now, which is not new, right? But perhaps it's underused, which is the CBCT, or the CT scan, right?
Is that the cone beam scan?
It's a cone beam scan. So it's a 3D image of your mouth in which we can really see in detail, pinpoint, and do segmented cuts of the bone and the teeth and all that. And that has allowed us to go a step further into diagnostic imaging, right? So we can really see silent inflammation. What is a silent inflammation? So a silent inflammation is something that is there, that it's sort of asleep, but it's actually putting weight into your immune system. So for example, we have always addressed our concerns in the medical field if it hurts or it doesn't hurt, right?
Right.
And okay, if I have a toothache, of course I need to go visit the dentist because this tooth hurts like hell, right? So there must be something wrong with it. But unfortunately, after you have a root canal, that tooth isn't going to hurt anymore because that tooth is dead. But there's some things happening around that tooth, and even though it doesn't hurt, doesn't mean that they don't exist, right? What you mentioned about wisdom tooth removal, okay? Traditionally, dentists, we would extract a wisdom tooth or any other teeth by that means. We would extract the tooth and we will close it, we will close the wound, we will suture it, right? Unfortunately, the body does not have the ability, the possibility of filling all that socket that was there with new bone, okay? So what it happens, and that's when it forms what we call a cavitation. A fatty osteonecrosis of the jaw, okay? Instead of that forming new bone, what happens is that the body uses that as a waste deposit, okay? It starts everything that it doesn't know what to do with, it starts depositing that there. It's usually in the area, the posterior area where the wisdom teeth were. Once we open those sites up, which we can determine and diagnose on a CT scan because we see a difference of density within the jawbone. So we go in surgically, we open that wound up, and what we remove that is nasty, okay? We don't do that anymore because we've done plenty of that, where we used to biopsy that. That was full of viruses, ranties, bacteria, parasites, and heavy metals. There is so many correlation with autoimmune diseases with all this that I mentioned before, okay? With different type of molds, with heavy metals, with ranties, with viruses and bacteria, okay? So imagine having that so close to your brain and the immune system trying to get that at bay so that it doesn't go anywhere else. So this is something that is one of the pillars of what we do. So we open these wounds up, we remove all this toxic waste that is there, we mechanically clean the area, but also we sterilize it with ozone. So ozone, it's a magic tool in our field because it allows us to sort of sterilize those areas and clean everything that's there, make sure that we have a blank space to work with. And then part of the process of what we do is that we use PRP on all of our PRF membranes, LPRF, IPRF, they have different names and different types of what we can create. Well, we draw a little bit of blood from our patients, right? We centrifuge this blood in order to be able to create this PRP that we need, and we will pack this into the wounds. We do it around their implants, we do this after all of our extractions. And the beauty of these PRP membranes is that they are full of growth factors, so they understand, they can differentiate, they allow for foundation for new bone to form. So it's a beauty when you do this and then you take a new x-ray 3-4 months later and you start seeing that bone being built over there. So this is autologous. This comes from the same patient. We're not doing anything synthetic. We're not using anything from another animal or from a dead person, right? Everything comes from the patient. So how clean and biological is that? I mean, so to us, that's one of the pillars of biological dentistry as well. Being able to clean all this, but allowing the body of the person to heal itself, basically.
It's incredible.
Yeah.
So, Dr. Mora, what you just shared to me is the essence of why I came here. I feel like biological dentistry is the future. I don't think it's going to be my last trip here. Let's put it like that. You know, I've totally revolutionized my mouth. Like you guys were the SEAL Team 6. I've had my wisdom teeth extracted. Every bit of metal is now removed from my mouth safely. And which I haven't shared, this is going to be the first reveal. First conversation, so since I was a kid, I have been biting my nails. And I chipped my front teeth. I also had a extensive number of fevers when I was a kid. And so I always had these stains on my front teeth. And you were able to fix them. And this is the first conversation where I have my new teeth. So I'm both enamored with what I love about this work is you're taking care of the under the hood, the behind the scenes,
Sure.
the deep biological aspect of the work, but you're also oriented towards making someone feel amazing. And I feel both aesthetically and biologically elevated. So I'm very grateful. And in the interest of taking this conversation as deep as we can go, I want to invite your colleague because I know that you have a deep vision as it relates to Tribe and what you guys are going to create. And I also know that you have the benefit of working with the leading functional medicine doctor in the country. So I would now like to take a moment to introduce Dr. Lizama. Doctor, it's a pleasure.
It's a pleasure, Ray. Thank you guys for having me. It's an honor. It's an honor. Yeah, truly.
So can you start off by sharing a little bit for the benefit of the audience around, luckily this audience, we've had other functional medicine practitioners, Dr. Hyman, a variety of others. So many will be familiar with functional medicine, but for the benefit of those who may not be, can you just kind of give a broader context into why I think this idea of the marriage, if you will, of biological dentistry, which I'm not, and I've gone to a lot of biohacking conferences, a lot of functional medicine conferences. I have not heard hardly enough about it. And still we're with a general public that hasn't heard much about functional medicine, right? And at the same time, you're seeing Dr. Casey Means being nominated as Surgeon General. So there are some steps forward, shall we say, in terms of of awareness. But share a little bit about your orientation as it comes to this visionary notion of what you hope Tribe will become.
Well, thank you so much. Pleasure to be here. Thanks so much for the invite. Like many of the forefathers, who have been sitting here with you, from whom I've learned tremendously, it's that vision of a more integrative approach, and it sounds cliche and everybody kind of says it, but at the end of the day, it truly has to be a more multivariable approach where you have to deep dive into a whole bunch of other different areas if you really truly want to undertake and be able to help our patients in the realm of the complexity of the human biology. That's just the way we were made, the way we were designed. It's not as easy as we would like to think that, with 1, 2, 3 little things, we can fix it all. And so once you start understanding, and it took me a long time, I'm like we discussed earlier, I'm MD trained, conventional allopathic medicine, proud to be a doctor, but my training was very, very in that sense, very formal and very dogmatic. And so it took me a while to kind of reshape, reform the way my mind would see things and the way that I was trained to understand that it's not one pill for this and just one single approach towards every one thing that you're dealt with. So when you go through time, and I've been in this while, close to 14 years now, you learn more and more as you dive deeper that this complexity just needs more attention, you know? And when you start hearing about this new era also of how oral health is having, or has always had, we're learning that it has just such a huge impact in regards to overall health, then, I mean, to me, it just makes sense. I just didn't know enough about it, you know? And now we're having more, thankfully, more science to back that up, to understand that there truly is this, you know, direct correlation between everything else that happens in the body. So just one of those funny things, you know, Dr. Mora, Alejandro, and I have been friends for, wow, man, just way too many years now. That's why we got so much gray hair. But it's just one of those things, you never really know exactly what your friends are doing, you know? And then after many years, you know, we just kind of bumped into each other and we started telling each other about what we were doing. And it was just one of those conversations that made sense immediately. You know, it was like, oh my God, I'm learning so much about this new era of the importance of oral health and everything else. And I've been doing this for so long. And he's the one that mentioned, you know, I think we should do something together because, you know, it just makes sense. And so that's what we've been working on for a while now, for quite a while now. We've been working really hard because we truly believe that this is going to just elevate the game for everyone who is truly scientifically interested in, you know, wellness, longevity, quality of life, call it what you want. So that's what we've been doing for a while now. And we really believe that Tribe is going to help. We don't want to be the only ones, but we definitely want to be part of this amazing change in this movement where it's going to happen. You know, it has to happen. That's just the way it is. And we want to be part of it.
Well, it's beautiful that you share that because, you know, what's been interesting for me just reflecting, because I came down here specifically for medical treatment. This is my first time ever doing that, right? We all know the health system, at least in the country where I come from, the United States, is not optimal, shall we say. That's the most diplomatic way to put it. And I actually have a great dentist, for example, in my home country, and he actually was the one who recommended Costa Rica, which is actually how I found this wonderful place. But what struck me is, as I was sitting in the waiting room, was how many people from how many different countries are looking for this, and how many people who are maybe listening right at this moment don't have access, right, to these kinds of practitioners. You know, like I don't know this to be the case. I'm very much in learning, but I would venture to guess that biological dentistry and functional medicine are not common practice in Costa Rica, just as they are not in common practice in the United States. Yet, unfortunately, we have more sick people than ever before. I mean, we have now more obese people on the planet than non-obese people for the first time in human history. And we've got 8 billion people. So that's a lot of illness and inflammatory illnesses. And so having a place to go to, I think now people are going to be looking beyond their town, beyond their city. They'll be looking for where can I go to have, and that was the piece that was important for me, was like, where will someone actually care about me? You know, like if so much of the Western paradigm, Peter Attia calls it medicine 2.0, right? Is that training of like, you know, you go, and by the way, good intentioned people by and large, but like, you know, you go into a doctor and then, you know, it's like, they've got 8 minutes, you know, that's all they got, 8 minutes. And they're going to diagnose whatever you got a heart, or you got a spleen, or you got a, prostate. Okay, well, it's not holistic, and you don't. And at least for me, when you're dealing with something that's so confronting and so vulnerable, like. For me, what I'm ultimately getting to is, I think many of us are looking for a place where we feel seen, we feel heard, we feel valued, and someone looks at the whole picture of who we are, right? And that's what's been the revelation for me here. I think this is the 6th or 7th time I've been in the office. Like, I feel like I'm friends with the staff now. Like, everyone's super friendly. Every time I see the doctor, I get like a hug. It's like a different vibe.
It's vibe, you see?
Yeah, exactly. And so that's I think that speaks to what so many people are yearning for. And I love that you guys are connecting also, because for me, that notion of the mouth being as a portal to the broader health of the whole human system, I didn't realize how important, integral the two are Can you share a little bit about how you guys see those two working together pragmatically? So theoretically, if I were to come down and is it something where it would be preventative, longevity oriented? Like I don't necessarily have, like in this instance, I might come back in a year or two, and it's not just I want to get my mouth and the systems of my mouth assessed, but I want to get my whole body optimized. Like I was sharing with Dr. Mora, I was potentially going to go down to Panama and do some stem cells after that. But then he was like, well, wait, because we might, and I was like, okay, cool. So what are the kinds of things you guys are looking at offering or providing in that synergy of the marriage of functional medicine and biological?
I'm just gonna do a little introduction and I'll leave it up to you. But what we were seeing in our patients was that sometimes, as much as you want to help, it is so important that the host receives well the treatment that we're gonna offer. So in order for some of the procedures that we do to be successful, we need the host to be ideally optimized. What do we mean by optimized? We need to have the very least blood work, and Dr. Lizano can talk a little bit more about that, but the right levels of vitamin D3 and the right levels of this and this and that. So the problem that we were and are still seeing, because there's a lot of patients out there, is that some of them, they want to receive the treatment, but they come to us and sometimes they are not ready to receive the treatment, or the results and the success rates are not as good as we would like them to be. And this was our missing link. And this is where functional medicine is so important at the beginning, during, and then after, to be able to provide not only good results for the biological dentist treatments that we're doing, but overall for maintenance and longevity and wellness and all that. So what we're planning to do is that, and I'll leave it up to you, but is before the patients actually come to us, they're gonna start their functional medicine journey before they can start the dental journey and everything else related, because we want to make sure that the patient is right from the start, right?
Yeah, and so to add to that, as some of the things that we spoke about earlier is one of the things that passionate me about this new era of, call it functional medicine, wellness, longevity, is it's a more proactive approach towards health. People who are looking for this or who are becoming more and more interested is because they want to be more actively, involved
For sure.
in their health journey. And so once you've been practicing long enough, you start to see that, because for me it's non-negotiable to have a very comprehensive initial assessment, an interview where literally I'm sitting with you for no less than 1 hour, because you got to be able to listen to your patient to really gather the information that you need. So right there, you're able to understand so much about that person that is in front of you. And then, we're in this era of amazing tools and resources where we can deep dive into all these different types of labs. For me, I love them, but they have to correlate. It has to make sense. So when you do that more and more on a daily basis, you start to, fortunately, but also unfortunately, find more things that are off than people think. And so there are things like, let's not get too technical, vitamin D deficiency. You don't wake up in the morning and be like, I think I'm low on vitamin D today. It doesn't happen, So there are a lot of things that are silent that you're really not paying attention to and you're not aware of. And you embark on this amazing journey of biological dentistry only to find out you have really low, vitamin D as one of many, variables. Your bone density is not up to par to be able to undertake all of this, all these surgeries and all of these procedures. So now and we're always going to have a great outcome, but what could have been an amazing outcome is now, going to be affected by all of these variables that no one paid attention to. And that's what we do in the functional medicine arena. Not only because we're looking and we're not looking for disease, we just want to see if you're deficient, if you've got any imbalances. Hey, just downright, if you're ready for this, are you ready to come down in 3 weeks and get all of this amazing stuff done? Or, hey, I just talked to you for an hour and I saw a few of your labs. And if I can give you my humble opinion, you should wait at least 8 to 12 weeks and get your stuff, straightened out before you come down. And that will definitely increase the outcome, improve the outcome. and it will be it's a game changer. Everybody wins, you know. And so this is where what we want to do is have a proactive approach. We want to educate our patients into understanding. That's what I tell my patients. Longevity medicine is a marathon.
Yeah.
You know, it's not a sprint. And so if you want to be involved in this new era of medicine, of health, then you got to understand that it's day in, day out. And so part of that is becoming more invested, more interested, and more active. And once you educate your patients at the very beginning, then before you know it, you know, they're on this path of health forever. I know it sounds romantic, but and that's where you really are able to heal, you know,
and create an impact, right?
I think what you said, both of you said it, is really beautiful. It actually evoked for me this notion of healing. And actually, like, so much of what I see also beyond even the medical context of you know, here in Costa Rica, or other places, you know, whether it be ceremonial work or whatnot, what you're talking about is intake, right? And intake and integration. In other words, what's happening beyond the treatment itself to foster and facilitate that deep healing. And what you just said about people becoming active participants, it really resonated with me because, you know, when I was talking earlier, I was thinking about, oh yeah, like what a different experience I've had here than times in the past, perhaps, where it's like, I mean, I don't need to be crass. It's like when you go to a mechanic and you're about to get, forgive me, like about, you know, ripped for $3,500 for an engine, because you don't know what you're talking about, and they do, and you don't even know if it's right or wrong. And sometimes the doctor feels like that. You don't feel like you're an active participant in your own healing. You feel like you're going to a mechanic who is going to tell you some stuff's wrong and it's going to be real expensive and hurt, and no one wants to deal with that, you know. Whereas I think if you actually have someone who's gets on the phone with you, gets to know you before you even go there, you're talking about, you know, like you're doing it's a process that someone's invited into, all of them, and they're the agent. That's such a, I feel like that's where we need to get back to. And it's really beautiful that you both shared that, because I think, unfortunately, a lot of what's broken in medicine 2.0 is that notion of being totally passive to the expert who's got no time for you and only sees a part of you anyway. And all, you know, we can go deep into that, but I was also incentivized oftentimes by the pharmaceutical industry to see certain things in a certain way. You know, it's you know, let's just say those incentives aren't necessarily oriented towards everyone's well-being. So, okay, beautiful. I know we're getting close to our time and you guys have treatments to get to, but if for those listening who are really both passionate about their own health and becoming agents for their own healing, are there any, I mean, there's so many, I'm sure you could talk about it for hours, but is there one or two things that you could leave them with as kind of kernels of consideration? So that would be the part one of the question. The second part would be, is there an invitation as you guys co-create this vision with Tribe that you might put out there for someone listening that you feel, you know, could be perhaps a different take on the healing process than what they're normally used to?
Yeah, from my perspective, what I want to leave you guys with is the idea that we truly believe that modern dentistry should be proactive and not reactive, right? And this is probably where we are failing in traditional medicine and dentistry, is that we're treating illnesses and we're not really looking for the root cause of it. So that's what we are focused on now, being able to diagnose things before they happen, right? Try to optimize our patients' health and well-being before they go bad. Let's not wait for it to go back. Let's just preventive. So I'm a deep believer in preventive medicine. And there are many ways to as you said, to try to make things better. But at home, there's simple things to look for. For example, I'm glad to hear that the state of Florida has now banned fluoride from, so now they're starting to remove all the products that are fluoride related in Florida. So that's a great start for the rest of the country and for the rest of the world to follow. So simply at home, fluoride is toxic, okay? Start from that. And I'm not gonna get into details, but if you can find good products, fluoride alternatives, not necessarily a mom and pop type of toothpaste. I mean, you still need to have some things, remineralization in your toothpaste, hydroxyapatite and things like that are natural. But just start at home with your kids. I have 2 daughters of my own. They're my own test subjects. One is 12 and the other one is 8. they've never had a fluoride toothpaste in their life, okay? And they have no cavities. And that's just, maybe it's just a little example of what this can be. But that tells you that it's not necessary, right? We can do things differently. We can work on our diet and all that. So at home, that, and also ask your dentist the questions that you really want to ask, even though you may not like the answers that they're getting. If it's something traditionally, look for someone that follows the same, I don't know, ideas that you have, and try to look for a tribe of people that has like-minded ideas, right? Simple diagnostic with the CT scan can tell you a long way of silent inflammation. And there's a lot of things that we can do to improve your health from a dental perspective. So that's my takeaway message for whoever's listening. I want to pass it on to you.
You know, something I tell my patients is that, of all of this excess information nowadays, is please do a better job at being more diligent about the information that you pay attention to. Because in this era of information, there's a lot of misinformation as well. Sure. And so this is why I believe educating, and thank you for this opportunity, because it is important that people understand that not everything that is out there really is backed up by science or by hard work or by things that really matter, or starting with something as, and it's not basic, it's something as fundamental, just paying close attention to what you're really paying attention to, for me, is a great advice that I give my patients, because you start to see all these people coming into your office with, and we could hundreds of supplements and hundreds of therapies, and you're like, oh my God, why you do? Whoa, hold your horses. You don't need all that. The human body is smart. We know how to fix ourselves. Pay close attention to the information you're listening to, and we welcome everyone here at Tribe, but just go wherever you want to go, but please go where they're doing things safely, responsibly. Just do your work. Be diligent about this part. And then another thing is, we are in this era of amazing resources where we have all these tremendously cool therapies and all. But at the end of the day, stick to the fundamentals. Again, everyone calls them basics. I call them fundamentals. Sleep, proper nutrition, physical activity. We're sitting here, but we're beings of movement. We should be moving more. I know it's hard nowadays, but it's got to be possible. Stress management, just social interaction, just this, having a time, to laugh and just engage in fun conversation. All of these don't require a pill. They don't require medicine. They don't require diagnosis. So sometimes you want to dive so deep into what's the latest resource and what's the latest and where do I go to? And sometimes the reason why we want to do this comprehensive assessment is because you find that a lot of these people don't have the fundamentals down. And so you got to start all the way back at 101, and so that lifestyle is super important. And so pay attention to those things, and all those things that I just mentioned are free. And if you're doing a lot of this and you still feel that you're off or you need more help, then we're here to help. But that's why this health journey is so important, that people become involved and understand that you have to be part of this journey if you really want to, if you want to make it last. That would be my takeaway.
I think that's beautifully said. It reminded me at the end there. I did an interview with Ben Greenfield years ago, and he's obviously deeply knowledgeable, highly scientific, encyclopedic knowledge. And but I said, okay, if you were to distill it down into one biohack, that everyone could do to, one thing, what would it be? And he basically said, nature, approximate nature, and get into nature. Yeah. And as you were talking, and I loved what both of you shared. It reminded me also, one of the other brilliant aspects of coming here to Tribe has been, I spent a week in Costa Rica in nature. Yeah. I wound up going to La Fortuna and soaked in thermal waters. That's amazing. And stayed with a family and walked on the farm and harvested I'm going to mispronounce it, guayabana. You know what I mean?
Yeah, the
Guayabana. Yeah, I forget exactly how you pronounce it, but and ate it at the dinner table, like you're saying, with this incredible couple, and was forced to speak only Spanish, and like so much of the Yes, there's the healing that comes in nature. There's the healing that comes in community, and then for the acute matters, such as the gums that are incubating bacteria that needs. Then you come to the SEAL Team 6. You come to the tribe. You come to the healers. And I think that's beautiful, because I don't think enough. And this is again my first experience where I've done this as an immersive experience. I don't think enough people take the time out of their busy lives to actually prioritize their health and their healing. And you guys have afforded me that opportunity in this last week or two, and I'm really grateful. I just want to say I'm going to link to Tribe, and I'll link to both of you in the show notes. Is there anything before we close that you'd like to share with the audience?
I think first, thank you for having us. Again, it's what we're missing, I think, from what we do is having a proper platform like this to be able to get the word out. As Dr. Lizano said, I mean, we love to see patients, and we love to treat our patients and see them through this wellness and longevity process. But we also want to educate. We want to spread the word out. We want to bring what's now called an alternative medicine, like functional medicine or biological dentistry, to becoming mainstream, because we really believe this is the medicine of the future, proactive and not reactive, right? So that to me, it's what we're here, educating, getting the word out, and hopefully having this more and more people know about it. Having a biological dentist or a functional medicine doctor right next to your house is going to become just the normality. Right?
100%. Actually, as you were talking, I realized I want to send some of my doctor friends over here. It's like, I've got a lot of friends who are also functional medicine doctors or whatnot. It's like, as you educate also the healers, because I feel like there's so much, I think well-meaning people, but you guys are, I appreciate the work that you're doing. Dr. Lizano, any closing words for you?
No, Alejandro said it amazingly well, and I already mentioned it. It's about educating and helping our community learn how to heal themselves as well. And with that, Tribe is we want to build a community. We don't want to be standalone. We're here together, and it's not many of us right now because we feel we understand the vision, but we don't want to be the only ones that do it. We want this to become, as Alejandro said, more mainstream, for this, because I know a lot of people, unfortunately, might not be able to come visit us in Costa Rica. And we don't want those people to not be able to have access to better lives, to more quality of life. So I mean, Tribe welcomes everyone here, but hopefully we'll create such a community where you'll be able to go, in your community to be able to get help. And for me, that if that's the impact, that's the legacy that we can leave for our kids, then
I'll take it, man.
I'll die a happy man.
Beautifully said. It's a great legacy. Well, gentlemen, thank you both for your time.
Thank you so much.
It's been awesome.
It's been awesome.
Do it again.
Awesome for me too. Let's do it again.
Let's do it again.